Resuscitation, CPR. This tape program accompanies workbook number 2, Recognition of Unconsciousness. It is part of a series of programs to help you learn CPR procedures for adult victims. This program has information for you on slides, audio tape, and a workbook. First, we'll ask you to listen and watch. Then the tape will stop. And in the workbook, you can practice the skills you've just learned. And as soon as you finish a workbook problem, you'll get the correct answers on the next page. That way, you'll know immediately if you're on the right track. But if something isn't clear, you can go back and listen to the tape again, or read it in the workbook. It has the same information in written form. Do what's best for you, but be sure you understand this material before you go on to the new section. This program will show you how to recognize unconsciousness and its related conditions. And once you know these, we'll show you how to position a victim for CPR. But first you have to identify the victim's problem. Then you can decide which of the basic CPR skills are needed to save a victim's life. First, please take a look at the objectives of this program. They're on page 1 of your workbook. When you've finished reading, restart this tape. Now, read page 1. Earlier, we offered this definition. And unconsciousness has 3 associated conditions. This unconscious victim has had a stroke. The associated condition, an obstructed or blocked airway. In this case, you'd have to keep that airway open and get him to professional emergency medical care. Here are 2 more cases. One of these victims has taken an overdose of drugs, and the other's breathing stopped after he choked on a piece of food which got caught in his windpipe. In cases of arrested breathing like these, you'd perform rescue breathing. And you'd have to begin fast, because cardiac arrest will follow if you don't restore breathing quickly. Cardiac arrest, the 3rd condition related to unconsciousness. If the heart stops beating, breathing also stops at the same moment. This time you'd have to help the victim restore both breathing and circulation. Now we've said enough. Time for you to apply these ideas. When the tape stops, turn to Practice Activity 2.1 on page 5 of your workbook. After you're through, score yourself on the next page. When you're finished and ready for more, turn on this tape again. And remember, you can rewind the tape and listen again if you wish. Now to Practice Activity 2.1. Arrested breathing and cardiac arrest. Speed is critical. You've got 6 minutes or less. That's all the oxygen left in a victim's lungs and bloodstream. If the heart is still beating, you've got a better situation. The victim's remaining oxygen will circulate for several minutes to the brain and other vital organs. But if the heart has stopped, the blood is not circulating. No oxygen is getting to the vital organs. You've got to move and do it fast. The brain is first to deteriorate from lack of oxygen. In the first 4 minutes after cardiac arrest, brain damage is not likely. But in 4 to 6 minutes, brain damage might occur. Your CPR must begin. And after 6 to 10 minutes, brain damage almost always occurs. Now, we hope you see why it's so important to begin quickly and to carry out the CPR procedures, and why speed is so critical. Most of the time, you won't know exactly when a cardiac arrest took place, and it probably didn't occur when the person first lost consciousness. Here's a cardinal rule. Give the victim the benefit of the doubt. Begin CPR. The purpose of cardiopulmonary resuscitation. This apparently healthy 45-year-old man has just collapsed on the tennis court. In most cases of this kind, the victim can be restored to a full and normal life. Begin CPR right away if breathing and heart have arrested. But in some cases, resuscitation may not be called for. Follow the advice of the doctor in situations like these. So far in this section, we've covered the importance of speed in restoring human life. A related topic is your legal liability toward a victim. Are you liable if you attempt CPR and it doesn't work? Or what if the victim recovers but there's brain damage? Well, the law in most states provides protection for lay persons who, in good faith, try to render CPR to an unconscious victim. If you begin CPR and perform it to the best of your ability, you will not be held liable for resulting complications or a failure to bring about a complete recovery. But once you begin the CPR routine, don't stop. You must continue until the victim recovers, or a competent person relieves you in the rescue attempt, or you are totally exhausted and unable to go on. And that completes this section of the program. Time for us to stop again. You're to do practice activity 2.2 on page 12 of the workbook. Score your answers, then come back to the tape for the next section. Now, do practice activity 2.2. Cardiopulmonary resuscitation involves three fundamental skills, the ABCs of CPR. The A is for airway. It must be kept open during CPR. In the next program, you'll learn that a simple tilt of the head opens the airway, and you'll learn how to keep it open. B stands for rescue breathing, mouth-to-mouth resuscitation. You're breathing for the victim. Program 4 will teach you those techniques. C is for circulation. Earlier, we said that if the heart has stopped, you must move quickly to keep oxygen flowing to the victim's brain. This is the third basic skill of CPR which you will learn. Program 6 covers this technique. It's called external cardiac compression, a way to squeeze the heart and pump blood to vital organs. Airway, breathing, circulation. When do you apply those skills? Well, let's review. If the victim has a pulse and is breathing, maintain an open airway. If the victim has a pulse and is not breathing, begin rescue breathing. And if the victim has no pulse and is not breathing, perform CPR. Open the airway, do rescue breathing, and start circulation. Cardiopulmonary resuscitation is an effective life-saving rescue technique. You can do it without any special equipment or devices, and you can begin it right away when you find a victim long before he ever reaches a hospital or professional help. You'll see it's a valuable rescue skill, and you'll prevent many unnecessary deaths. There are a number of steps in the CPR process, and there are a number of critical decisions to be made. We have created a tool to help. It's a diagram called a decision tree. The decision tree outlines step by step what you must do. It identifies critical decisions and tells you next. Don't panic when you first see it. It looks complicated, but there is a logical flow through it in this program. You know much better. Let's look at an example. Section of the decision tree, we show you what to do after you've recognized unconsciousness. What is the next step? Call help and position the victim. After that, open the airway. We've touched on these points earlier in this lesson, so you can see how they... The decision tree also poses critical questions for you to answer in dealing with a victim. What do you do if the victim is breathing, and if he's not? The actions you must take are clearly shown for you. The steps of cardiopulmonary resuscitation are illustrated in the CPR decision tree. There is a copy of the decision tree printed in your workbook. Turn to page 20, study the diagram, then restart this tape, and we'll go on. Now, to page 20. Now it's time to test yourself again. Check your understanding. Please turn to practice activity 2.3 on page 21 of your workbook. Then check your answers on the following pages. When you're ready for the next section, restart your tape recorder. In the last section of this program, you learned that the CPR decision tree summarizes the steps you must learn and know in order to save lives. It will help you in the rest of this program, so we suggest that you put a paperclip on the page of the workbook so you can find it easily. Keep it in front of you for the rest of this lesson. When a person loses consciousness, whether or not his breathing has stopped, his body relaxes fully and usually ends up in a crumpled position, face down. Imagine these situations. One person was working in his office until a few seconds ago when he suffered a heart attack. The other was enjoying a high-speed ride that was suddenly cut short. Wet tiles by the pool. And a faulty home appliance. Now, before you rush to give emergency aid to these victims, consider the possible danger to yourself. In the case of the auto accident, for instance, what condition is the car in? Is it apt to explode into flames? And how did this person get electrocuted? Are there exposed wires or other sources of electricity that might endanger you? Be realistic. You must be concerned with the possible danger to yourself in any rescue situation. You wouldn't be of much help to a victim if you were injured too. Likewise, you must take special precautions to avoid further injury and complications to the victim of such a serious accident. What if there are broken bones, for example? This would affect how you do CPR. But first you must learn all the basics of CPR without complications. Therefore, in Units 2 through 7, we will only deal with medical emergencies such as heart attack, stroke, or suffocation where the victim does not immediately appear to have broken bones or other complications. Most often you find a victim just after the collapse. What's happened? How can you tell if he's really unconscious? The simplest, quickest way is shake and shout. Hey, are you okay? Shake and shout is the simplest procedure you can use to recognize unconsciousness. And that's the first step on your decision tree. And the second step was call for help and position the victim. If he doesn't respond, call out for help. Even if no one is in sight, call out. Hopefully someone will hear, someone who can help or who can go for help. Remember, time is critical. You must begin CPR. If anyone else can call for medical assistance, the victim has a better chance to survive. A victim, he's unconscious, help is coming. You're going to begin CPR. But first you've got a problem with his position. What is it? To perform CPR, you'll have to roll this victim carefully. If there's been neck or spinal injuries, you could complicate things. You have to kneel and place your hands just right so you can move the head, shoulders, and torso at the same time with no twisting. That's not as simple as it sounds. An unconscious adult is hard to move, especially without twisting. You can't tug or jerk suddenly either. So let's talk you through the basic steps, each one in detail, then we'll put them together. First, kneel beside the crumpled victim, a few inches from his side. You've got to allow enough space for the width of his body. Otherwise, when you roll him, his body will end up twisted over your knees instead of flat on the ground. If the victim's arms and legs are twisted or in the way, you might create more injuries if you don't reposition them first. Raise the victim's arm, which is nearest to you. See how the rescuer here moves it gently and straightens it out above the victim's head. Then he'll adjust the legs so they are nearly straight or bent only slightly at the knees. Now place one hand on the back of the victim's head and neck to prevent it from twisting. And with your second hand, grasp the victim under his arm to brace the shoulder and torso. This will be the major point on his body where you'll pull to roll him over smoothly and gently. Then pull steadily and evenly to bring that weight around. This will be the major point on his body where you'll pull to roll him over smoothly and gently. Then pull steadily and evenly to bring that weight around. The problem, you don't have a third hand to hold the waist and keep the torso in line. But if you pull evenly, carefully, the torso and hips will follow the shoulders without much twisting. As you roll him over, watch the head and neck. Keep your eyes there. There may be neck or spinal injuries. You don't want to complicate matters, and you do want him flat on his back so you can begin CPR. Now, let's look at that sequence again. First, kneel by the victim and straighten his arm and legs. Place your first hand behind his head and neck for support. With your second hand, grasp the victim under his arm to brace the shoulders and torso. And pull evenly and steadily to keep the body from twisting. The victim should end up lying flat on his back in front of you. In this position, you can apply any or all of the needed skills of CPR to save a life. Next, we'd like you to study the case studies in Practice Activity 2.4 in your workbook. Then see if you can identify correct and incorrect techniques in Activity 2.5. Score your answers, then start your tape again. Now, 2.4 and 2.5. You've learned a number of important concepts in this unit. Let's sum them up. We know that unconsciousness may be associated with these three conditions. Cardiopulmonary resuscitation, or CPR, combines three basic skills to maintain or restore life. You've learned the first two steps of CPR, how to recognize unconsciousness and how to roll the victim over to begin CPR as you call for help. By now you realize this person needs help. You know that time is critical. What do you do next? Well, before doing anything else, you'll open the airway. This often lets the victim breathe again on his own. But if the victim doesn't begin to breathe for himself, you'll have to begin rescue breathing for him. In the next unit, you'll learn how to open the airway and how to check breathing. But before you go ahead, be certain you've mastered all the skills in this unit. Rolling, for one thing, is not as easy as it sounds. But practice makes perfect, so turn to Skills Practice 1 in the workbook. Then, when you've practiced, turn to the post-test in your workbook. Complete it correctly, and you're ready for Unit 3. And good luck.